Walk with me as we take a broad-ranging tour of the world of cannabis, from the ancient to the modern, the medical to the recreational, as well as the social, cultural, and political landscapes of this fascinating plant. I am Dr. Drjakefelice, and this is the Cannabis Matrix, where cannabis science meets cannabis culture, where recreational meets medical, and where the body's own endocannabinoid system is as much a player as CBD or THC. Welcome. Hi, and welcome to episode 3 of the Cannabis Matrix Podcast. Today we are going to be talking about topical cannabis, specifically enhancing pain relief with topical cannabis, and how cannabis can be good for skin conditions like acne, potential scarring, wound healing, and other uses as well. If you didn't have a chance to tune in last week, I did a fair bit about discussing cancer in cannabis and anti-cancer properties of cannabis. So tune in to see that. And thank you for listening. If you like the videos, please subscribe and also click like. I'm Dr. Drjakefelice, and this is the Cannabis Matrix Podcast. What really excites me about topicals is they're really a good point of entry for folks who don't know very much about cannabis. And one of the reasons for that is typically topicals do not give patients a head high. So folks using topicals can get pain relief, including pain relief with THC products as a topical without causing a head high. Topical cannabis does have pain relieving properties, also has anti-itch properties, and antispasmodic properties. So, for example, patients with MS can utilize topical cannabis to the spastic musculature to some degree of relief. Also, vasodilation is a property of topical cannabis. That's usually not typically thought of something as helpful medically, but if there is a problem with blood vessel dilation in the fingers, such as Raynaud's, that a lot of people get, especially in the wintertime, the topical cannabis can be helpful for that. One of the main barriers that to topical medicine is the absorption across the skin. The product must deliver the cannabinoids and the terpenes from the outside of the body to the inside of the body. And when we use a topical, it has to go through the skin. Sometimes products and cannabinoids can enter through sweat glands or through hair follicles, but typically does have to cross through the skin layer. What are exactly topicals? There are many different types and forms that they can come in. There can be oils, there can be gels, there are topical patches, balms, spray tinctures, suppositories, which are rectally inserted, and they even make cannabinoid solutions as eye drops. Not something that I recommend, but I will talk about that in a bit. One of the things that really enhances a product's ability to help is we know that topicals are dose dependent. So the more product you have, the more cannabinoids you have in the product, the more effective it's going to be. This is almost opposite of what an oral preparation or even an inhaled, we talk about using the least amount necessary. But with topicals, because of the way they work, it does help to use a lot of them. And remembering that they do need to cross the skin barrier to get into the underlying muscle or into the areas where the nerve fibers are firing pain signals, that type of thing. One of the ways that permeability across the skin can be increased with topicals is through the use of an alcohol tincture. Alcohol will enhance the ability of the cannabinoids to get through and as I said, into the tissues. Also, the cannabinoids and the terpenes are all valuable. They cross the skin barrier but at different degrees. So for example, CBD and CBN cannabidiol and cannabinol, CBD and CBN, will cross the skin 10 times more easily than THC. This doesn't mean that we should be using only one of the cannabinoids such as CBD because the THC definitely can be helpful. But just to realize that THC is not really very easily crossing the skin barrier, so it needs to be present in high enough concentration to do that. And then the other cannabinoids that many folks are familiar with, such as CBD, really do cross that skin barrier very quickly. I also mentioned briefly in the intro cannabis suppositories. These are things that can be rectally inserted, and they can be very helpful in diseases where there is inflammation of the colon, such as an ulcerative colitis, where there's any type of inflammation in the colon. Also, for folks with pelvic and rectal cancers, you can use suppositories with the idea of delivering some of the cannabinoids to the surrounding lymphatic tissue. So that's the kind of the idea behind that in terms of suppositories in cancer patients. I did mention the eye drops. Topically, eye drops can reduce pressure for glaucoma patients, but I don't really recommend this. Better to stick with conventional pharmacology and medications for things like glaucoma, in my opinion. So, but what are topicals helpful for? Well, here's one study that I'm looking at, topical therapy in facial post-herpetic neuralgia. So neuralgia after herpes. This could be in the case of a shingles infection, or it could be in the case of herpes sore. They can be quite painful, especially for some folks. They get worse than others. So for this type of pain, for a nerve pain, the cannabinoids can be very good, even sometimes when opiates aren't as effective. And topical cannabis in human studies, we do know, has been effective for post-herpetic neuralgia. Also, we know that this is from the journal Inflammation Research. Topical cannabinoid receptors agonists are well-tolerated adjunctive therapy in post-herpetic neuralgia. So another study on the post-herpetic neuralgia. And what we're seeing is that cannabis is working a lot like an antihistamine, but there are other mechanisms as well. But what we do see in the literature is there is an antihistamine part to all of what cannabis and the cannabinoids are doing. But really where I think I find a lot of use with topicals is with muscular pain, meaning you worked out too hard, exercised too much, or if you have maybe a generalized low back pain or neck pain in the muscles, the topical cannabis seems to be very helpful for, and a lot of people like it. Now remember, the more you use as a topical, the better a lot of the times, and also the total amount of cannabinoids is important. This will affect your price point. So not all products are created equally. But very much so, cannabis is effective for muscular pain. Also, the topicals can work in conjunction with other medications, such as NSAIDs, with opiates, or even with edible cannabis. And the reason that works is that we have pain receptors in the periphery of our body, that meaning on the outside of the nervous system. And so if we take a cannabis edible, for example, that can work in the central nervous system. But when we use a topical, you also get an extra added relief out where the actual site or the source of pain may be. A way to think of this is think of a Bluetooth speaker. You can change the volume of the speaker right directly on the speaker itself, or you can use your phone to change the volume. So if the volume of the sound from the speaker represents pain, we can use a centrally acting pain reliever, which would kind of act like controlling the pain at the level of the Bluetooth speaker. But you can also apply a topical in the periphery, which would be like turning things down with the cell phone versus at the Bluetooth speaker. Anyway, I don't know if that's a great analogy, but might help some folks understand why it's good to use a topical along with other cannabis products, or even along with conventionally prescribed medication. We do know, this is from the Journal of Controlled Release, transdermal application to mice on their stomachs provides relief from a type of an experimentally induced foot pain that mimics plantar fasciitis. So the topical application on the stomach can help in other areas as well. And if anyone has any requests for these studies, some of them are a little rare, just email me, drjake at drjakefelice.com, and I can send you the peer-reviewed references. Also, there is potential application for topical cannabis in physical therapy and physical medicine modalities, including massage, physical therapy, as I mentioned, and even acupuncture. The cannabinoids in the topical can actually reverse trigger points, which are kind of those hot spots we get in our muscles. You ever feel a boulder in your shoulder? That kind of a tight area usually represents a trigger point. Topical cannabis can be, specifically THC, can be very helpful for that. And THC-oriented topicals, just in this particular study, also decrease pain thresholds and help in the connective tissue remodeling, fascial reorganization through fibroblasts. Could this be something that is helpful for wrinkles in the skin, for example? I think it's a reasonable hypothesis. It's certainly something that could potentially benefit the underlying connective tissue within the skin. Also, topical cannabis will synergize with other topical products. So if you have just a plain cannabis oil and you put like a tiger balm with a little bit of heat in it over top of that, a lot of the times the capsaicin, which is the kind of the hot pepper product that is in the topical, can synergize with cannabis and provide greater relief. So you can utilize synergy with botanical topicals. And also looking at a study here in the journal Pain, topical cannabis enhances topical morphine pain relief. So the results from this small study are showing an anti-pain interaction between topical opioids with topical cannabis, so that the cannabis topically is also helping the opiates work better. We see this a lot with cannabis. And I mentioned before that the effects from topicals are dose dependent, typically meaning that the more you use, the better relief you get. This is not the way it is with a lot of cannabis products, so feel free to put a question in the comment section. I'll be happy to help with that. And when in this one particular study, and this is in the journal Pharmacologic and Biochemical Behavior, this study showed a 48% reduction in neurodegeneration, which was induced in laboratory animals from alcohol. So they gave the laboratory animals enough alcohol to cause a neurodegeneration, and the topical cannabinoids reduced that. So we're getting a central effect from a topical. I had mentioned before in another podcast I had done on the In My Grow podcast that I had not seen yet plasma curves for topical pain patches. This particular one is showing a plasma concentration of 100 nanograms per ml, which is definitely enough to have a therapeutic effect. That was for a CBD product. So the CBD, remember, is much easier to get into the body, but we are getting those at relatively high levels. Just for a perspective, 100 nanograms, what that is, I believe in Washington state that the DUI for THC is 5 nanograms per ml. In this case, a different cannabinoid, CBD, reached 100 nanograms per ml, so about 20 times the DUI limit, even though it's a different cannabinoid. And what that's showing is that we can get, using a topical, we can get a fair amount of it into the central circulation. And that has potential medical benefits for folks. So what can topical cannabis be used for? I had mentioned muscular pain. If there is, for example, a painful herpes blister or something from like a shingles type of a pain, anywhere where there's a blister that might easily be popped by putting a topical on, you can use a spray so that doesn't disrupt the skin. Very good for itching. Good for insect bites and poison ivy along those lines. We do have a lot of information now showing that CBD is effective for acne. And it makes sense because CBD, even at low concentrations, is a very wonderful antibacterial, and it has really good penetrating capacity, even against MRSA strains at very low concentrations in the test tube. We're seeing effectiveness. I've had patients successfully use CBD for skin tags, including warts. Many of my patients have reported resolution in basal cell carcinomas of the skin. I recommend working with an oncologist or a dermatologist as far as that goes, rather than treating yourself, but it's one of the areas. Also, if you are a loved one or a patient receiving radiation treatment for cancer, a lot of the times the radiation will create a sunburn-like phenomenon on the skin. The topical cannabis can be very good for that, and also very good for your general run-of-the-mill, go to the beach and get sunburn. The topicals can be really good for that. They do enhance wound healing locally. It is controversial in non-infected superficial scratches, etc. the use of CBD. The reason it's controversial is because it hasn't been studied, but a lot of folks are reporting enhanced wound repair, which is consistent with a lot of the information in our scientific literature. So it's a short topic, topical cannabis, but I think very important. Remember, you can use topical cannabis for pain. You can use it for a lot of different skin conditions. Typically for pain, you get a minor reduction, usually about 2 points on a 10-point pain scale. So if my neck pain is a 6 out of 10, typically the topical, in my experience with a bunch of patients, takes that down about 2 points, so to about a 4 out of a 10. And that may not seem like a lot, but it is done with very low toxicity and without causing a head high. And you can also add in your other medications. So I think that the topical cannabis is an excellent first line. Major downsides of the topicals, they just don't last very long, meaning the relief that you will get from topicals is typically 2 to 4, maybe upwards of 6 hours, depending on individual characteristics of the pain as well as the product. So I do have a lot to say on topicals, but I'm going to keep it short. I would encourage you to feel free to ask questions in the comments section below. I'd love to hear from you. This is Dr. Drjakefelice from the Cannabis Matrix Podcast. Please feel free to like and subscribe, and I'll look forward to being with you again next week. In the meantime, you can find us at drjakefelice.com, also at cannabismatrix.com, as well as on SoundCloud and iTunes. Thank you so much for listening.
Well, it was in my childhood days. Oh Lord, the many long years ago. Now with the Spirit, now of my Savior, I was filled, Lord filled, oh in that old fashioned meeting.